good evening. I'm Dr. Darshan again. So the outline would be under these questions. Okay, what is the pattern of the exam? What is expected out of the candidate, that is you, the examinee? Okay, and then definitely I will be giving you a lot of sources for review and preparation. I've been asked a lot of times in the groups about PPTs for a lot of other preparations. Unfortunately, we cannot share all the PPTs. Okay, but definitely we can give you the source so that you can go read about it. Okay, so you need to prepare yourself. You are the only person who knows, your capacity and how you can assimilate data. So that is one thing I want you to understand. Okay, so firstly, what is the pattern of the examination? The exam is conducted in a single day. It has these four divisions which they have. Usually they have long cases and short cases session pre-lunch. Okay, and post the lunch they will have stations and viva tables. Okay, long cases, you'll have two long cases and then followed by two short cases. Okay, usually what happens in the long cases or short cases is they'll give you the summary earlier and then it goes about. Okay, in brief, the whole examination is for a marks of total 300. You need to get a mark of 150 for passing. Okay, it is the cumulative mark that is expected out of you. It is not there individually you have to clear. Okay, so 150 out of 300, wherein 150 marks is for your long and short case. Long cases you will have 50 mark each, so that will be a total of 100. Short cases will be 25 marks each, that will be 50, so that encompasses 150 marks. Then you have the 150 marks for stations and viva. You need to get cumulative of 150 to pass. Individually they're not asking you to pass anything, which is actually a good way. Okay, so don't have that hesitancy or worry that, okay, what, I didn't do my long case well, so I might not pass. It doesn't matter. Okay, so keep your confidence level high. It's okay if you make errors once in a while. It will not be causing you to fail the exam altogether. So always be confident and try to move on. Okay, that is what is important. So long case, I was telling you earlier, usually they give you a summary and then it will be given some time for examination. Usually they give you roughly around 20 to 30 minutes. Okay, usually the long case consists of major systems. Okay, always remember ARDS will be there. A pneumonia case or a community acquired pneumonia will definitely be there, or else it can be any other issues like ventilator associated pneumonia, etc. So respiratory system is a short case. CNS and trauma, short case. Definitely, any center will have one or the other, case regarding to CNS. Toxicology might be a plus or minus. Okay, if they have a case, they might keep it above. Otherwise, usually you never know. Okay, so basically, a long case will be having multi-system involvement. Okay, and with the multi-system involvement, the candidate will be given a brief summary, and the whole examination is expected out of you. What do I mean by that examination is sometimes you have to go through the history, you have to do the examination of the patient, look into the patient investigation chart, you have to know what all has been done to the patient in the period of stay. So always make a note of when the patient was admitted, what are the key events. Okay, so say suppose your patient came to your ICU 10 days ago. In the 10 days, what are the key events? What was the condition on arrival? What deterioration happened? What did they do for the deterioration? When did it happen? Okay, that timeline is what you need to mark down in your answer sheet. You will be given a paper. Okay, like how you had the theory answer sheet, you will be given a sheet like that. You need not be very legible. Okay, just write down the key events in that and key examination points. Okay, they will take the paper from you in the end, but yeah, you need to write few notes in that. Okay, so that it is easier for you to summarize also. Okay, I will tell you how to present a long case in brief, but definitely we will discuss about long cases tomorrow. Sananthas will be doing that. Okay, so as I told you, it's 30 minutes of examination and 30 minutes for viva. Few places I think so they'll allow you to use the ultrasound. You can ask if you can use it. Okay, sometimes there have been centers where you have been asked to do a bedside POCUS examination. If at all they ask you, please do it. If at all they don't, also just find out if you can use the machine. Okay, and always make sure that you are aware of your surroundings and then proceed. Okay, so you need to be very courteous. So whenever you enter this exam hall, right, so greet all the people around you, especially the nurse whoever is there at the bedside. Okay, a person would be definitely helping around. Okay, like an expert examiner, just speak to them, introduce yourself. Okay, so try and make the environment as friendly as possible. Yeah, don't be over friendly, but yeah, at least break the ice between the two, have a conversation. Okay, so that you get comfortable and they also get comfortable to communicate to you. Okay, sometimes you might get some brownie points as well. Okay, so some examiners perspectives they will give you, so that will help you in the doing the exam in a stress free manner. Okay, so this is majorly about the long case. Short case, what happens is they give you a brief summary of the short case as well. What usually the short case consists of is it's a focused scenario. Sometimes it can be just focused on something like a hepatorenal syndrome, or probably acute kidney injury. Okay, or something like decompensated heart failure, something like that. Okay, it's a very focused scenario they will give, and then they might ask you questions based on that. Definitely in the viva they can take you to the other system, but more or less they will start with the system per se. Based on how you answer, they can take you elsewhere. Remember, here you will be given 10 to 15 minutes of a prep time, and after the 15 minutes period you will directly be asked question. Okay, usually the examiners have a lot of time. Usually you will have four examiners, so two examiners will be the people who will be coming to the bedside, and they will be discussing, and they'll be taking your examination. So question answer session will definitely be for the due time of at least 10 to 15 minutes for short case, and 30 minutes for the long case. So this is majorly about cases. So I told you cases overall consists of 150 marks. After this, usually this gets over by afternoon, and after that you will have your stations. So stations, you have multiple things. Usually it depends on the center. They can either divide it into 4 or 5 stations based on the number of candidates. Okay, so what usually the stations are is, one station usually consists of the airway ventilation and ABG, wherein you will be asked to identify various waveforms, ventilator dysynchrony, management of difficult airway, okay, interpretation of data like ABG, etc., or ventilator graphics. When they give you, they can ask you about something like maneuvers, etc. Okay, so this is one station. The other station definitely would be imaging and data interpretation again. Here, more or less, it would be a radiology and your laboratory investigations. So you need to know certain radiology for sure. You need to know about your chest X-rays properly. You need to know about your CT and MRI of the brain. Okay, and then obviously there are certain conditions of the abdomen and thorax, like pulmonary embolism for thorax and abdominal aorta aneurysms, pyelonephritis, probably even pancreatitis. You should know these are the things where they are classical signs which are present, right? Those images would be given to you, and then you'll have to interpret. So that time they can ask certain CT scorings. Okay, if you have an SAH, probably they can ask you SAH grading, or if you have a pancreatitis, they can ask you CT severity index, etc. So that's how it will you routinely go about. And off lately, because we are routinely using in most of the centers, point of care devices are becoming more and more available. So tests like TEG and ROTEM you might have to go through again. Okay, so this is something that you have to revise. We've already discussed this in our theory classes. If you guys can read that for the data interpretation classes in the later period, it would be helpful. Okay, so this usually consists of station 2. Station 3, ACLS and hemodynamic monitoring. This is something that is very important, and most of the examiners will be very keen on how you answer the station. They will look at how safe you are and how attentive and how protocolized you are. So they will make sure that whether you are going through the protocol properly, algorithm is being approached at the right way. Okay, so make sure that you read your ACLS and brush up these things. Okay, so very carefully you need to know the drugs, the dosing properly. Okay, so if you make errors in this place, it might be a little tricky. Okay, they might think about scoring good for you. They'll not be happy, because it's a very focused exam and very focused station, right? So please make sure that daily you start with an algorithm, keep presenting daily, so that you are aware as to how to approach to it. The other thing in hemodynamic monitoring, they can ask anything from arterial lines, CVP waveforms, IABP, pacemaker, etc. Okay, we will be dealing with all of this in the classes which we have planned for you guys. So this is one station where you might be looking at that. Okay, drugs and equipments, sure shot. It's really difficult, for us to complete all the drugs, but we have got a lot of feedback from our on-site class, so we have tried and done something more positive in the online classes. But yes, it will be really difficult for us to teach all the drugs, but you are supposed to know the most common things which were being used in the ICU. Fluids, okay, that is one thing you have to know. Antibiotics, all the anesthetic drugs which we are using, obviously the inotropes. Okay, so these are the things that you need to know in and out. There will be a format in which you need to present that I'll be discussing with you guys tomorrow. Okay, this is a station where you can score more. Okay, so always be attentive when you're reading about it and make notes of yourself. Okay, probably pick one or two drugs every day and read it and make notes. Okay, that format is enough, because in the end you cannot take a huge book or the phone and then look into all the drugs for revision. When you make notes of your own, probably it will be easier to revise on the last day. Okay, equipments, yes, you need to identify, probably tell about the indications, contraindications for that, and troubleshooting of those instruments, etc. That is what is anticipated, and the questions can be guided on how you answer the questions. The one most important station which is very close to most of the intensives of late is the USG and the POCUS station. This can either be clubbed with your radiology station, or this can be a separate station by itself. Please know the basic echo windows. Please know few protocols, okay, for the lung ultrasound, and as well as the shock protocols, etc. You need to know all of this. Okay, so this is something which is beyond doubt, that they will not think twice to score you less. Okay, so make sure that you are aware of these protocols and go in a systematic way. Okay, please revise. I think so you've read it earlier, but yeah, go through it again, and then it will be easier for you guys. But basic things is what will be asked for you. Don't worry about some very high funda questions or few signs which you might have not heard. Don't get panicked at that point if they ask you some sign that probably you might have not heard or you forgot at that particular time. Don't worry, they would not hold you to that point, and they won't fail you. But definitely, if it is a very common sign like lung sliding, if you're not answering a pneumothorax along with the lung point, that might be something that they might hold you to. Okay, so these are the things that you need to be aware of when you're going to this station. So this is about the stations. After this, we have a Viva session as well. In the Viva, there is again 4 stations. It starts with thesis. Definitely, there will be 2 examiners or sometimes 1 examiner, depends on how the center wants to conduct it. They will ask you about your thesis. So be very clear about your objectives, okay, and know what is the statistical tool that you have used, what is the power of your study, what are the limitations of your study, and what is the outcome of your study. Don't go there and don't open your thesis to tell. You should be confident enough, bold enough to tell your study, because you have done it over a period of 2 or 3 years, right? So that is something that they are looking at. Okay, so always remember, questions on statistics can be asked either here or in critical appraisal. Okay, so no, start practicing your statistics again. I think so the YouTube video is still available, the class we have taken. You can go back and start revising your statistics from there from now onwards itself. Okay, otherwise it's really difficult to cover statistics as a separate session. Okay, critical appraisal, I think so Dr. Srihari will take the class today, and then he'll let you know with certain examples as to how to present. When you're presenting the critical appraisal, what they usually give is they give a study to the candidate. They'll give at least 10 to 15 minutes time for the candidates to go through. Okay, see, I'm telling you 10 to 15 minutes. There have been instances where they might ask you at the end of 5 minutes also, but if you know what to look for in the study, you will be able to do well in the 5 to 10 minutes period. Okay, as soon as you get that, how to make note of the key points in the study. Okay, where to look for limitations, where to look for all the statistical tools. This is what you need to mark. Okay, and when you mark it, you'll have a fair idea as what is going on. And when you go inside, the questions will again be on what is the study on, what is your comments, what would you want to do. And one question they routinely ask is, at the end of this trial, would you want to implement this in your center? So that's not, that doesn't mean that you have to say that I will. They will ask you to substantiate. If yes, why? If no, why? Okay, that's what they're looking at. You're going for a consultant level examination. Okay, that is something that they're looking at. Are you a sane enough consultant, a safe enough consultant at that level of thinking that you can implement certain changes? Okay, that is what they're looking for. Communication and ethics, I think so. This is one area where they can take you for a ride. Don't worry, don't get intimidated, and don't get scared either. They will intimidate you. They might create scenarios where they can harass you also. I mean, it can look like an harassment, like how you routinely things are happening in the country, we all know about it. So yes, they can go to a certain extent that you can get a very tough relative. So they are looking at how you communicate and how you diffuse the scenario. They look at how valid points you're raising. Okay, what are you going through? Are you going through in a safe pattern? Okay, so interprofessional counseling and family counseling is something that is very important. They will look at your basic communication skills here. Definitely breaking bad news, conflict resolution, theoretically we can talk a lot, but whether you're implementing this theory in your practice is what they're looking at. Okay, the fourth station is on audit, quality, and patient safety. Main thing is, majority of the places I've seen that they club it with critical appraisal and they finish it off. Sometimes they do keep it as a separate thing. When they do this, they're going to ask you questions about quality indicators in your hospital. Probably they will ask you if have done any audit in your course period. They might ask you questions about quality indicators, antimicrobial stewardship, etc. So this is what is expected in the fourth station. All of the station roughly consists of a half an hour period. Okay, so they have enough time to spend with you to analyze your knowledge and your approach to things. Definitely you'll not be able to give 100%. Don't expect. Sorry. Okay, this is the issue, I think. So we have Bhagishri, can we unmute them? Okay, I'm sorry. Sorry guys. Okay, so next, this is how the conduct is. Okay, so I briefed you guys about how the long cases and short cases would be, how the station vivas and the table vivas would be like. So what do the examiners expect out of the candidate? That is what we need to know, right? So in the long cases, present the case in a very clear format. Okay, so that is what is expected out of you. Please have a summary ready. Okay, look at the critical care aspects more than a medicine aspect per se. Look at what is relevant in the critical care scenario and present those points clearly. Always it's really difficult for the examiner to look into a whole history, right? So you might start off presenting and then they might stop you in between and tell, please summarize the history. So when they say that, please be very skillful and give them a crisp summary. The way you summarize itself will create the first impression, because remember, when you start the exam, you start with the cases, and when you provide a crisp summary, they know that your basics are strong. So then they will have an understanding that they can move on to the examination, and then they can continue with the actual management of the case. This is one trick that you guys have to learn. Okay, so if you provide a very crisp history, that actually gives you a lot of leverage. Okay, and then the examiners will take you to the next step as soon as possible. But if you have been let to talk about history, even you are bored, the examiner gets bored. Okay, so try and get that first impression on the examiner that you know your case well. Okay, always, I told you earlier as well, be mindful of your surroundings. Always develop a rapport before you start. Look whether the patient is conscious. Sometimes you'll have conscious patients in the ICU. Introduce yourself to the patient, the attending nurse, etc. There have been instances wherein the examiners, can talk to the nurse later on as well. They can get all the relevant things that they want from the nurse as well. They'll look at your hand hygiene practices, your communication skills, okay, your examination skills, and how you conclude. Okay, all of this is something they are very closely going to monitor. If they are not there at the time of examination, definitely they'll come around later and I'll ask the nurse whether the candidate has done so and so things. Okay, sometimes examination also they can ask the patient themselves as to has this been done to you. Okay, so follow the bedside etiquette, basic hand hygiene. Always do something called as an endobedogram. Okay, you actually stand at the end of the bed whenever you're given a case summary in a long case, right? You get alarmed with it. Sometimes you'll be like, what is happening? Before even you see the summary, when you reach the end of the bed, right, you can see the things around the patient. That itself will give you a vague idea as what is going on with the patient. If you see a patient on a ventilator with inotropes, okay, probably an RRT machine which is parked by the side, you will know that the patient is having a multisystem disorder, probably has ARDS, probably has acute kidney injury requiring RRT, etc. So these are the things that you need to look at. If you give this thought, you'll be almost fixated in your mind that okay, I need to look at these particular pointers. Okay, whether the central line is in situ, where is it in situ, how many days has it been, what is the condition of the line today, what is the condition of the catheter today. So these are the things that gives you of more input as well. Okay, so these are small nuances that I'm trying to tell. It is not something that will be given in the books. It's something that will help you get your uh, you know things going in order. Okay, so this is something that I wanted to talk about. Nutrition chart is mostly missed. Okay, majorly all of us are so focused in our treatments that we forget nutrition as being most important. Okay, that is something. Please ask for the nutrition chart, ask about the feed tolerance, okay, and what type of feed is being given. Okay, sometimes they can just throw a googly. You'll be talking about ARDS, you'll be talking about RRT, and then suddenly the examiner will ask you about what is the nutrition giving, what is the thing that the patient is receiving, or what is the status. So that will totally derail your course, because firstly you would be getting a sudden a shock, and then things might take a turn there. Okay, so it's okay, sometimes you will get questions like this. When you get this, please uh, excuse yourself at the scenario. Okay, just tell that okay, there will be a certain things that you might have missed. Okay, so you can tell, I'm sorry, I have not done this. Okay, but yes, if you miss the most important thing, that is not something good. Okay, so one or two smaller errors of omission can be okay, but gross omissions, I think so, would be detrimental. Okay, so that be aware of all such things. Okay, so make sure your history is good, look at what is the patient on, document all these things, look at the nutrition, look at all the relevant investigations, focus if possible, do it. Okay, whenever they ask you to give the diagnosis, so first impression you've created with history and examination, etc., when you're providing the diagnosis, also give them a clear diagnosis. At this time you have all the investigations. It's not like a medicine case in your MD exam, right, where you give your differential, I mean your differentials, and then you would tell that I'll do the investigations, I'll think about a diagnosis. No, here you have everything at your disposal. You can give them a diagnosis and also tell them that I'm keeping a list of differentials even though I have these. Okay, so always give a diagnosis and then tell them these are the list of differentials. Okay, uh, I told you earlier as well, I'm reiterating that point. Please write down all the findings. They will tell you, but nevertheless, please make sure of all the points whichever you are, examining or taking the history. Just write it in that sheet. Okay. Coming to short case, I told you it's very brief, very focused. So here also you might have to write one or two sentences about the case. Look at the examination. If it's per abdomen examination, look at all the things that is involved in the per abdomen examination. Okay, so just don't do a percussion and then forget auscultation altogether, and don't forget to I mean, if the POCUS is available, you can definitely use the POCUS at that time as well. Okay, so I know, but don't just run in and do a POCUS for every patient. Just ask them, do your due diligence, do your initial evaluation, and then you can go about getting for a POCUS examination. Remember, you have only 15 minutes. Okay, just don't wait for someone to get the machine. All of that can take a little logistical issues. So look at the history, look at your endobedogram, then you have a vague idea of what is happening, and then go to the laboratory investigations. So when you have this thing sorted, right, you have the history, you have the findings with you, then you can corroborate with your labs, and then you can come to a diagnosis. That is a swift way of going through things so that you can arrive at a diagnosis. Okay, then definitely they will quiz you about your management. So cases, don't worry. Okay, remember one thing. Okay, this is a consultant level examination. You are expected to answer like one. Okay, don't give theoretical answers. Okay, a long thing. Just be answering to the point. If they ask a question about definition of ARDS, answer only about definition of ARDS. Okay, don't give extra knowledge. It's not required. Okay, summarize the data in a very structured format. Okay, don't haphazardly start off. Whenever they ask you to summarize a lab detail, don't start off with one thing and go on talking about, start with CBC, suddenly you go to LFT. It shouldn't be in a haphazard way. If you're starting with the CBC, what are you looking at in the CBC pertaining to the case? Okay, so that is something that you have to talk about in a very structured manner. Okay, and how is it relevant to the case? Always corroborate your data to the case. Okay, that is very important. Bedside etiquette, I've been stressing this is something that they are very particular about. Hand hygiene, probably one or most of us are actually worried about the evidence, right? They won't take you, they might not fail you just because you don't know an evidence fully. But yeah, landmark trials you need to know, major evidences you need to know. Okay, like surviving sepsis guidelines, you have to know it. Major trials in ARDS, you need to know it. Okay, so anything which is intervention based and which is given as level 1 evidence, that is something that you need to know. So these things, if at all it is pertaining to your case, that is something that you need to answer, and then they'll be happy to give you more points and probably get a better score. Okay, always remember one thing. If you are not knowing something, don't bluff. Okay, if you want to do an educated guess, you tell, I'm not sure, but I based on these things, I'm taking a guess. But never try to bluff. Okay, that is something which the examiners do not like. It's just like you're digging your own grave, and then you'll go into a vicious spiral. Okay, so try and avoid that as much as possible. Okay, I will just say, try and just omit it. If you don't know something, please tell, I'm not aware of it. Okay, stations and viva, it's again a time dependent thing. 30 minutes odd is the time point. Okay, so you will be given many options. Okay, if you have certain thing or an instrument you might not know fully, try and answer as much as possible. If you're not knowing, just go on to the next one. They will definitely move on to the next drug. Okay, drug or the instrument or so on. Okay, one thing you remember, if you've not felt that you have done up to the mark, it's your perception again, because you still don't know what is the overall outcome. If you feel that you haven't answered one or two questions, don't worry. It is not going to matter that you are going to fail because you didn't answer one or two questions. Okay, definitely I told you the cumulative marks is what matters, and in the end it depends on that. Okay, so don't carry whatever happened in the cases to the stations. Okay, that is something that you need to leave it in the cases. In the afternoon, go back with the same amount of confidence and rigor and zeal that you will do well. Okay, so probably you might score better in these stations, and in the overall outcome, if it matters, that you might do even better than what you did in cases. Okay, always listen to the examiner, listen very carefully of what they are asking. Okay, so few examiners, it's most of the times it depends on how the examiner is. Okay, so you need to look how they are asking, what, whether they want you to take a guess, etc. Okay, so few of them would not like you to use unnecessary words. Okay, so they would be listening that looking for a particular answer in a particular format. If this, you would know by the time you come to stations, so answer it the way the examiner wants. Okay, it's not, I'm not telling you to impress them, but at least not piss them off. Okay, don't make them angry. Communication station, use your soft skills up to the mark. Only thing they're looking at is how you are able to diffuse the session. Okay, they're not looking at their overall outcome. And don't worry, they're not, nothing will matter at the end of the day. It is a mock drill which is going on there. Okay, so don't get scared, don't get worried. Okay, but don't cause any mishaps. Okay, don't promise some person that you're going to give them some remuneration, etc. Okay, no, nothing like that. Always make sure that you give a midway. Okay, own up to few certain mistakes, that is always told in conflict resolution, probably, yes. Okay, but yes, don't expose your staff. Okay, then answer in a way that does not offend the person as well. Okay, so you focus on your spikes protocol for breaking bad news, etc. So you have that thing fixed when you're answering. That is something that you have to do it on a day-to-day basis. So start presenting on a daily basis, especially communication is you speak to your seniors or whoever is there, present cases, and then ask them to give you examples of case scenarios, and then you can brush up your soft skills. Okay, this is more or less about how to prepare for the exam. Rest, this is something that most of the examiners felt, and there's a few feedbacks that we got. They also look at how you are coming to the exams, so please reach the center earlier. Don't go there sweating, huffing and puffing. Okay, so don't go breathless on the time of examination, and as soon as you enter that you are breathless, and you're just trying to get acclimatized. Go to the center early, a day prior. Get used to the surroundings. I've said this in the on-site class as well. Okay, be accustomed to your center earlier itself. Even in the center, go find out which floor, whatever it is, because most of the centers are in big corporate hospitals. So you need to know your center in and out. Okay, so that you don't have that worry that next day where is it, where to go, and all this confusions on the early morning of the exam, that will be offset. Okay, so please present yourself in a good way. I mean, formals, that is going without any say. Don't forget to take your thesis. Don't forget to take all the documents of the exam. Okay, that is something that you have to not forget, and there's no excuse for it. If at all they ask you to give your thesis, you may have to definitely show thesis and logbook. Please carry with you. Okay. Uh, Rest of the things, I think so it's quite the similar one which you do for any exams that you prepare for. Rest as much as possible. I know it is difficult, it's very easy to say right now, but yeah, it will be a little haunting day prior to the examination. I know a lot of stake will be there for that exam, that just one step away from your degree. So yeah, keep it as cool as possible. You have done well all these ways, you have cleared your theory, that itself is a reassurance that you guys are good. Okay, just keep that going. Okay, avoid carrying books to the exam center as much as possible. It's easy to say. Okay, even I have carried, and I hold myself guilty for that. But yeah, in the end, I realized that I didn't open the book. So we don't have time. As much as possible, if you're having one or two sheets that you want to brush through, some cheat sheets or something like that, you can take it. Books unnecessarily, I think so. We don't have time. Frankly speaking, I never got the time. So it's out of experience. I'm telling, please don't carry them. Okay. Eat well, stay hydrated. Okay, that is very much necessary, especially given the fact that our exams are in the summers, so that matters a lot. Okay, so unnecessarily falling sick on the day of exam actually can put down your efforts which you have done for all this while. Lot of sources are there, I'm not going to dwell about it. You guys already know because you have already prepared for your theory exams. Case based review, totally, you have all the cases provided there. Okay, finish it off. Critical care updates, if you guys have prepared during the theory, you brush up whatever you have read. Don't read anything new. Okay, internet book of critical care, evidence-based practice, these are the things which I usually go through whenever I have some issues. Nature reviews has always been the savior. It is actually a good thing. Most of the diseases per se, like your GB syndrome or acute kidney injury or TTPHs, TTP and all, you can use the ISTH website. Okay, the hematology journal, they're all good sources for reviews. Okay, wherein you can have the overall picture of the disease and management. So a lot of resources are available. I won't say that you guys go and pick up all these right now and start off. If you have used them, well and good. Better not to do any new research. But case-based review, I think so you guys have used it for your exams, so stick to that as much as possible. Okay. Most importantly, the thing is present it to your peers. Okay, whoever is there in your hospital, if no one is there, probably there are centers where the single candidate will be there from a group amongst yourself. Okay, whoever you are comfortable with, I was the first batch DRND, so the only thing is we formed a group amongst ourselves in Bangalore, and we discussed among all of us. So one of us used to present, and another one used to ask questions. We used to, have role plays of examiner, examinee ourselves. That's how we actually came across, and then that's how we could understand things better. So it always helps. You form the group, don't waste time. It's your comfort zone. The only thing that you need to achieve is exposure to the number of questions and the data that you accumulate at the end of it. Okay, so it's just going to be a revision session. More you present, you know the questions, and your brain will give you the, eureka moment. As soon as the question is asked, you're like, yeah, I know this question, I can answer it. That's what we're looking at. Okay, so for last minute, I've always found this ICU one pager to be a good source, and LIFTL, we all know this. I'm not going to speak much on that. Okay, so on that note, always remember, if you made an error anywhere, don't dwell on it, forget, and just move on. Hard work definitely pays, but remember, smart works always, it rewards you well. Okay,